Well, the first thing I think of when I hear the word female, I think about female empowerment and women's empowerment, which is fantastic because I'm a women's studies scholar. So I'm always on board to support research that supports women and is looking to improve the lives of women. So that's the first thing. A second thing, of course, is looking at the acronym and seeing the word endometriosis in there. And it's been really fantastic to see projects such as this getting more funding over the past 2 or 3 years. Because as we know, endometriosis is a condition that is not really known a lot about, and it's something even a lot of medical professionals don't know about. So just seeing that acronym and seeing there's this huge research project and EU funded that's actually doing something to better inform people about endometriosis and reduce the amount of time that women and other people with endometriosis are having to wait for diagnosis is really fantastic to see. I think one of my biggest strengths as an academic is the impactful nature of the research that I do. So, in the past few years, academia, people are talking a lot about impactful research and the importance that the work we do has a positive influence on society. And for me, that's always been really important in my research. And I think the whole point of us doing research and finding solutions to problems is to make a difference. So I think that that's where my strength lies in terms of my research. So my research is about the impact of activism on young people's understanding and perceptions around menstruation. And this, of course, includes what they know and think about endometriosis. So the work that I'm doing, I've spoken to young people in schools, I've gathered their thoughts, and in doing that, I've seen so far the positive impact the period movement has had. The young people I spoke to, they are far more informed about periods than in previous research that's been done in the UK as of about 5-10 years ago, and part of that has been thanks to social media. They're slightly better, they're a bit better informed, but more so they are definitely more positive. They're more positive about periods, they're more comfortable talking openly about them. And some of the young people I spoke to were confident talking in mixed gender groups as well, which was fantastic to see. And all of this information I'm reporting back to NGOs and charities. So there's the positive that I just mentioned. There's also many other areas that charities and advocates and activists can improve or can do more based on what the young people have told me. So, for example, some of the male students I spoke to, who were between the ages of about 16 and 19, they said specifically that they'd come across periods in different contexts. So, for example, YouTube videos that were about studying, and the female person who was talking in the video talked about how she managed her periods during exams. That kind of thing really helped to normalize menstruation. Another example, the young people I spoke to said they didn't really know like what level of pain was typical. They didn't know when they should go to a doctor. They hadn't had formal education in schools. So it's definitely up to, one thing that activists and charities can do is try to encourage the teachers and perhaps go in and give talks to like help them out teaching these subjects. Because even though it's part of the UK curriculum and it has been for the past, since 2020, it doesn't seem that that's actually changed in schools. So that's something that my research has shown. So that's kind of what I like to do, kind of find out problems and then report them back to the charities and activists who are making a difference and kind of help support them to kind of better engage with young people via social media. So I think that's probably one of my main strengths. And as well, I think I've been quite fortunate in that I started doing research about menstruation back in 2013 as part of my PhD. And it was only about French literature, and it wasn't about, it wasn't fieldwork or anything like that. But I was looking at these novels and I was looking at how the women in the novels experience menstruation, and the novels showed that menstrual experience is intersectional. So, someone's experience of their period can be affected by their family life, can be affected by their ethnicity, their social economic status, their sexuality, etc. I think it's really important that people take a very intersectional view towards menstruation And that's something I've tried to replicate in my research as well. So I started that research back in 2013. And since then, the menstrual movement has grown, and we've seen a lot more attention of the movement on social media and the mainstream media since 2015, which became known as the year of the period. And I've been monitoring that movement since before then. So I just feel like one of my strengths has, in a way, just been completely coincidental that I've been monitoring this movement since it's kind of became very popular in the media since 2015. So I was really excited when I first heard, when Ulrich first contacted me last year to say that he was looking to work with someone with expertise about social experiences of endometriosis. So yeah, first of all, it meant a lot for me to be recognised as a researcher with expertise in that area. I'm an early career researcher, so I'm 4 years post PhD. I've only been in social sciences for, well, just over 3 years now. So to have my research recognised and for someone to want to draw my expertise for a larger project is, first of all, that's wonderful. But for me, the most important aspect of it has been this opportunity to potentially have a positive impact on women and people who have endometriosis. And it's been another outlet for me to be able to share my research findings as well. So a few weeks ago, we did a webinar. So it was me and Ulrich, the project lead, and a few other researchers as well. And we all shared our research about endometriosis and people's awareness of it, and how this might lead to there being longer diagnosis times, for example. So it gave me an opportunity to show that the young people I spoke to, the reasons why they weren't going to the doctor if they suspected they might have endometriosis, or even if they had a lot of pain, was that, well, on social media, they'd seen a lot of things about period pain, about strong period pains. And to them, they just thought, if I'm in a lot of pain, that's just normal. That is what's having a period. And that's not just a attitude we see on social media. That's something we see across society as well. There's kind of for a long time been this societal expectation that women have lots of pain, and that's just women's lot in life to just endure that pain. So that's one of the things I was able to share as part of that webinar. And another thing as well was from my own findings that young people as well, they see adverts in which women on their period are jumping around and having a great time. And they were saying how toxic that can be, because it makes them think that it's not normal to maybe need to rest a bit when you're on your period or to be in pain. And that had kind of put them off talking to doctors as well. And also I was able to share the fact that I've spoken to some non-binary participants as well. And 2 of them said that they didn't want to talk to the doctor about period pain because in the past they've been told that they should try going on the pill, but they felt that conflicted with their gender identity. So the fact that I've been able to share these results before I'm able to get them down into the publication, because of course publications take ages, and I've been able to share them with the contacts that FEMaLe has all over Europe and beyond as well, has been great. And FEMaLe not only has contacts with other researchers, but also young people and GPs and activists. So to have that platform to share my research findings is wonderful. But as well, which is really important, is the opportunity to collaborate. So I'm doing my very own independent research project, and I spend a lot of time at my desk just writing my book, writing articles. And I think it really is important that we share our ideas. And it's not only good in terms of, for quality of research, but also to feel kind of less isolated as a researcher as well. So I found it really motivating to have this connection with FEMaLe. And Ulrich is wonderful with coming up with ideas for new projects and made me feel really included. For example, putting together an abstract for a conference to present a poster. So it's kind of opened up some more avenues for my research and for forming really positive relationships and making collaborations with other researchers and people with other expertise. So I think my benefit to the FEMaLe project will be my kind of unique take on young people, and in particular their awareness of endometriosis. So, for instance, in my research, I've spoken to young people across the UK to see what they know about endometriosis. So this is not just with people who have the condition, but young people in general, because obviously it's really important that all young people have awareness of what endometriosis is so they can better support their friends and family who have the condition. And my research has been really successful. I've been to lots of schools in the UK and I've spoken to a lot of young people, and they've told me many things about social media and how social media has influenced their perceptions and how they've heard of endometriosis via social media, but also how they've learned about the condition from family and friends as well. And this has given me really good insight into how young people's knowledge of the condition has improved over the past few years, but it's also given me insight into what gaps there are in their knowledge as well, and what changes they'd like to be made in terms of their curriculum at school. So what I can offer to the project is the fact that I've done this really successful study in the UK, and in our recent meeting in person in Aarhus, I spoke with Ulrich, the project lead, and some other members of the team, and we talked about the idea of kind of replicating my research methods and conducting some focus groups in schools in Denmark and also with partners in France as well. And I think that my kind of perspective as a social scientist who's very interested in diversity and inclusion and has experience in these areas as well can bring a lot extra to the project, because it's important that any outputs, including apps or websites, are inclusive, both in terms of gender and making sure that people of colour feel included as well. And finally, and another exciting thing that's coming up soon is that I'll be collaborating with members of the project to produce a poster for a conference that really shows the benefit of the relationship between myself and the FEMaLe project. So when I was first doing my research in schools, I was looking very specifically at social media and how social media has influenced young people's attitudes and knowledge towards endometriosis. But when the FEMaLe team contacted me and asked me to be an advisor, they were talking about their focus on why there's such long delay for endometriosis diagnosis. And I looked at my research findings in a different way and realized a lot of what the young people said to me was really relevant to that, and was able to answer that question as well. So for instance, a lot of young people spoke about the fact that pain is very much normalized, and they wouldn't necessarily think about going to the doctors with period pain because they're constantly told it's normal. And they also raised issues such as saying that they didn't know when to go to a doctor and what level of pain was typical. And yes, my relationship with the FEMaLe project and thinking about how to collaborate has made me realize that my research findings are actually applicable to answering other questions as well. So I'm really looking forward to proceeding with the project and seeing where this collaboration goes. First of all, I'm hoping that the research that I'm doing will aid in improving gender equality. So I am looking at the impact that activism has had on young people's awareness and perceptions of menstruation, even endometriosis. And as part of that, I'm looking at their knowledge and understanding of social issues that affect women and people who have periods, things like period poverty, and things such as kind of experiences of people who aren't women that have periods. So kind of social issues are really key there. And of course, if a woman experiences, for example, experiences period poverty, that's going to affect gender inequality. So basically, my research is looking at these young people's understanding and experiences of all of these factors that lead to inequality and reporting these back to charities and NGOs. And they're using my findings from my research to shape their policies and shape their practices. So because they're already doing work that's improving gender equality, I can kind of contribute a little bit to that. But there's kind of more direct ways. So for instance, at the moment, I am collaborating with the British Standards Institute. So I'm leading a project alongside someone based there who's really fantastic. And she has basically started to draft this document, and it's full of guidelines for employers, and it makes suggestions on how employers can improve the workplace for women who menstruate and also women going through the menopause. So I've been supporting her with redrafting that document, and we've organised a committee of women and people who have expertise in all sorts of aspects of menstrual experience and menopause, so that we've brought that together and we're working through these guidelines, and hopefully, a lot of businesses in the UK will be implementing our suggestions, and that will help the experiences of women in the workplace. And if women are better supported in the workplace, then that's going to contribute towards gender equality. So that's kind of one of the more direct ways. And I guess, of course, FEMaLe, one of the main reasons that FEMaLe exists is to improve gender equality. So I think by being on the advisory board and co-writing publications and presentations and giving advice on inclusive research, then I'll be influencing gender equality there, hopefully, as well. And I think in the future, when I finish my current research about the impact of activism on young people's understandings and perceptions of periods, the next thing I want to do is a very similar project on the menopause. So the media movement around menopause started more like 2018, slightly behind the period movement. But now in the UK, I think menopause has suddenly hit the media a lot more with Davina McCaw, who's this UK TV personality, and she's done some TV programs about the menopause. So it's now starting to be in the mainstream agenda a bit more as well. So I want to look at the impact of all this media coverage and fantastic work that activists are doing around the menopause, and see if that's led to a reduction in societal stigma around the menopause. Have menopausal women become better supported? So thinking about gender equality in terms of the menopause as well. So I think that's a basic summary of what I'm trying to do. Well, I think for me, what I've been doing is more that I've been doing the research and then presenting my ideas to other people who are then putting it into practice. So, I've presented my findings and guidelines to charities, and they'll be putting those findings into practice. And I'm planning on writing, this is something I have to do this summer. So I'm planning on turning my results into a document. And the document will include mention of endometriosis as well, besides other aspects of my research. And it will give some quotes from the young people that I've spoken to about their awareness of endometriosis and their understanding of it. And it will make, and I'll make some suggestions to advocates and charities on how they can kind of better engage young people in conversations about endometriosis, and what young people want to hear more about. They wanted to hear more about not only kind of what level of pain is typical, they want to know what volume of bleeding was typical. So this document, I'm hoping to share it with charities, go to charities in person, present the document, talk about it, and then it'll be up to them to kind of implement my findings in their practices. And as I said before as well, I'm hoping that my findings around endometriosis will be in the British Standard document that we're writing, because it's very important that employers know about endometriosis, because of course people and women that have endometriosis, they might need some more time off work because they'll be in too much pain to work, or they'll need to manage their period at home. So it's important that employers know about endometriosis as well. So hopefully employers will see it mentioned in the document, and if they don't know about it already, they'll be able to learn there what it is and what specific support that they can give to women who have endometriosis. For me, on a personal level, I've already had a lot of benefit of being involved with FEMaLe. So the first one was that I got to present some of my findings for the very first time, very much hot off the press, just finished analysing my focus groups. So FEMaLe gave me the opportunity to present my findings about young people's awareness of endometriosis and social media at a webinar. And the webinar was fantastically attended. And there was a really fantastic diverse audience of GPs and patients and researchers and advocates. So it gave me a platform for my research there, which was great. And as well, those of us who were on the panel at webinar, we put together an article for the conversation. So Eileen, who was based at a university in Canada, she wrote the first draft based on everything we'd said. And it meant that those of us that spoke on the webinar, our research got shared via the conversation, which is a really great outlet for research. So it was really nice to see some of my findings, to be able to write about some of my findings there. But as well as I've just benefited just from this fantastic collaboration with FEMaLe, having someone to talk to about my findings, hearing about what other researchers are doing. Because I know it's really important that we don't kind of repeat each other's research. So being able to have, being able to talk to people in FEMaLe and being part of the wide net of FEMaLe has kind of helped me as well to see what kind of other research is out there and kind of making sure that I'm not duplicating existing research. Yeah, that's I feel like I've already gained quite a lot through my relationship with FEMaLe, but I guess I'd like as well to work on some publications, like co-write some publications together to bring together my particular expertise in social sciences with FEMaLe's expertise in science and kind of see how those work together. So yeah, I'm hoping that I'll have some co-written publications with FEMaLe, but also I'm hoping that I'll have more opportunities to present at conferences alongside the members of FEMaLe. So Ulrich has already got in touch with me to make a poster for a couple of conferences next year, like a career. So just looking forward to more co-authored articles and co-written conference papers as well. But also, of course, gaining a bigger platform for my research and more potential to have an impact outside the UK. I think the biggest issue with endometriosis is a lack of awareness. And I think that's something that has improved over the past few years. But I think that what really needs to happen is that endometriosis becomes part of the school curriculum, that young people are learning, male boys and girls are learning from a younger age what endometriosis is and what the symptoms are and how they can get help. So I think that education really needs to improve. So I think that's that's the biggest issue. And as well, of course, another huge issue is lack of funding for research on how to more quickly or more effectively diagnose endometriosis and how to treat it effectively. But I know that's something that FEMaLe's working on, which is excellent. I think since 2015, when as I said before, periods became so much more part of the mainstream media agenda and so much more visible on social media, it has led to greater awareness of endometriosis. I mean, yes, not that many people young people I spoke to had heard of it, but a third, it kind of rang bells for a third of them. They knew there's something to do with periods, something to do with pain, and they knew the word, weren't exactly sure what it was. But they'd seen, influencers on social media talking about endometriosis, talking about, waiting for operations, talking about waiting to see doctors, talking about not being believed. So those discourses were floating around on social media. Young people had seen them, which is great, because I think before social media, they would have had less opportunity to read about endometriosis. And as well, because the menstrual movement has helped to destigmatize periods, young people are more open talking about period pain. So they're probably, because there's less stigma, a woman with endometriosis is more likely to go to the doctor and say, I'm having quite bad period pain. I've heard on social media this thing called endometriosis, kind of what is it? And then, she could reach out to Endometriosis UK and get support that way. So I think there's been quite a few strides in awareness. There's a lot further we can go, but the media spotlight on endometriosis has really helped, and my research has shown that. So that's fantastic. I think that just needs to translate now into education in schools to make sure that young people know accurate information about endometriosis, because the young people I spoke to, as I said, they didn't really know what it was. Some knew it was something to do with pain, but some of them had inaccurate ideas about what it was, or they believed myths on social media. So there needs to be accurate education in place so that young people aren't absorbing misinformation from social media as well. So awareness is great, but it needs to be accurate information. So that's a really difficult question, because there are so many aspects of women's health that have been ignored, that require more research, that require more support from the medical profession in general. So it's a really, really tough question, what aspect of women's health that I prioritise. I think there's many different aspects of women's health as possible, so women can receive better care in general. I think from a personal, I think it depends on what country in which you live as well, where funding already exists. So in the UK, obviously, we have the NHS, which is an absolutely wonderful organisation, and we are so privileged and so lucky to have free medical care. And it's just really sad to see the NHS being underfunded and slowly privatised. And for instance, I had a baby recently, and I was in the hospital for a few days. And there were some really, really wonderful midwives there, but the department was hugely, hugely understaffed. And a lot of midwives had left during COVID because of the pressures on the job. So there needs to be more funding placed in maternity wards as well. They need more staff there. I know that the midwives there told me they were trying to recruit more staff, and it was difficult because there weren't enough midwives trained. So I mean, midwives, more investment in them, and there should be possibility for when we need particular healthcare professionals for them to be able to train for free, like nurses to be able to train for free. Nurses shouldn't have to pay to train, in my opinion, nor should midwives. And as well, I don't know a lot about the medical degree that doctors do here, but I'm sure there would be more space for emphasis on women's health particularly. And to make sure that that they're learning about endometriosis, that they're learning about other conditions that affect women, like premenstrual dysphoric disorder. That's another menstrual related condition that there's not a lot of awareness around. So yeah, I think it's a difficult question, because there's so many aspects of women's health that we don't know enough about, that need more funding and more investment.